Newborn babies have been found abandoned in parts of the country recently. Last week, a 6-day-old premature baby was found in a hospital waste bin. This was just days after another newborn was miraculously rescued from a stormwater drain in Durban. Well, we're joined in the studio now by Nadine Grabham from the Door of Hope Children's Mission to discuss what options are there for new mothers who are desperate and believe they cannot hold on to their babies. Nadine, good morning.
Good morning.
Thank you very much for your time. Very tragic story this. I mean, each time we talk about it, you just wonder what really happens. From your experience, from a Door of Hope Children's Mission, what would lead to such a development, really, from what you know? Let's start there first.
Yeah, so mothers that we have counselled over the years, I think the biggest reason is poverty. We have a few illegal immigrants in South Africa who don't get social grants for their children that are born here. Rape plays a big part as well, and teenage pregnancies, drugs and prostitution, I think, are all factors that add to child abandonment.
That means underlying that is a lack of support or understanding either from family or social structures.
Yes.
Because if a young woman or a woman has been raped, and that was not supported, and she fell pregnant, that talks to a lack of support and understanding.
Yes, definitely.
If we talk about poverty or people coming from outside the country can't get social grants, it also talks that there's no support in our society for such cases.
Yeah, there is definitely a lack of support for these mothers.
Yeah. So, I mean, what could a young mother do? I mean, I was talking to our colleagues now in the newsroom before we went on air. Think about the age group and think that maybe when you're a teenage pregnancy, it's a really desperate situation where I could understand. But the older you are, in your late 20s, you think, well, you could also maybe try and do something different. But when somebody in such desperate circumstances, I guess there's very little that's available to them at the time. They just see darkness that they can't do anything about it.
Obviously, desperation and even depression plays a big part in the decision that these mothers make. I think it's a matter of creating awareness that places of safety safeties exist, as well as crisis pregnancy centres. So there are support groups all around South Africa that can help the mothers.
Should maternity clinics play a role here? I mean, if you're pregnant, you have to go to a hospital, you have to attend some clinic of sorts, prenatal care and stuff like that. If you're young, should also the clinic, at the clinic level, somebody should be saying, hey, young lady, you're so young, did you want this pregnancy? Are you supported? Or are you aware that you could go there and go there?
I think we've had mothers, especially very young mothers, that have gone to clinics and hospitals looking for some counselling from social workers. Often they come back and say that they've actually been put under a lot of pressure from social workers and nurses saying that you've put yourself in this mess, get yourself out of this mess. So it's sad to hear that, because they're reaching out for help and they're not actually getting it. So we, as Door of Hope, we've spoken at hospitals to say, if these mothers come to you, please refer them to us. There's so many child protection organizations that can assist in these cases.
So just from this example, it looks like at this level our healthcare system is failing these young mothers.
I think it can improve quite a bit for these young mothers, and just like I said, creating awareness about places like Door of Hope would be a big help.
Yeah, the MEC for Health in KwaZulu-Natal was speaking about these latest 2 cases that have taken place in Durban and saying this is a kind of, should be taken up as a clarion call to raise more awareness about family planning, contraceptives. But I think there's an age limit where you can get access to contraceptives. I think if you're younger than a particular age, you can't get contraceptives. Am I wrong?
Which doesn't make sense, because you can have an abortion at any age. So really it should be, you should have access to it. Same with mothers under 18 can't give consent for their children to be adopted. But their parents have to give consent, but they can have abortions at any age. So it is definitely a contradicting situation, that this should be freely available. Is
it your view that we should be more flexible? We know what legislation says. For example, in South Africa, due to poverty, we have many child-headed households, and it could be a young lady who's heading the home, and then will happen either unfortunately to be raped or fell pregnant because they were not aware of contraceptives, they should be able to be given that opportunity to make the decision to say, I can hand over my child for adoption.
Yes, definitely, but they're not. And I think also what we lack in South Africa is safe haven laws. So even if a mother leaves her baby safely at a police station or a hospital or a fire station, she can actually get prosecuted. So we definitely need to work on our safe haven laws in South Africa to give these mothers options that they can leave their baby safely at a police station or a hospital, or even places like Durban, but like our baby box, and not face prosecution because she's doing what's in the best interest of her baby instead of leaving a baby in a stormwater drain to die.
Yeah, instead of treating these kind of cases as either black or white, we must understand there's a lot of grey in between,
yes.
a lot of complexity, and we need to show a little bit more understanding than
yes,
we're currently
definitely.
doing. Thank you very much. That's Nadine Grabham from Door of Hope Children's Mission, helping us to understand what kind of options young new mothers who are desperate can have rather than really dumping their babies in stormwater drains like